Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director, providing you the update from Albany Medical Center. Today is Tuesday, June 23rd. Normally I have to ask myself what day it is, but I don't have to today because today is my daughter Kate's 16th birthday, June 23rd.
Happy birthday, Kate.
Happy birthday, Peanut. All right, let's take a look at graphs that we are familiar with. We actually have some new graphs today, so I'll go through these graphs relatively quickly, and they're all good news. The first graph is what's happening within the 8 counties of the capital region. You are familiar with this graph. It looks the same. There are currently 37 people within the 8 counties that are being treated for COVID-19. At the high water mark, that was 205.
Tremendous.
And in the ICU, currently there are 5 in those 8 counties, and at one point that was as high as 100. If we look at the graph which represents activity just inside here at the medical center, let's pop that one up. This is COVID-19's admissions and discharges. So above the horizontal line are cases coming in the hospital, and below are cases leaving. You can see admissions are slowing down. You can see discharges are picking up, and also good news, the last time we had somebody who died from COVID-19 in the hospital here was about a week ago. So that is also very encouraging news.
Very encouraging.
And then the next graph is our activity here, our AM census, the activity in the hospital with COVID-19. And you can see currently we have 24 people in the hospital. And Fred, I think the breakdown is 22 on the floor, 2 in the ICU, and nobody currently on the ventilator.
That's right, Dennis.
All right. So Fred, why don't you jump over, and I think you have some graphs to share with us as well.
I do, Dennis. So we've looked at a lot of graphs related specifically to COVID, but let's look at some graphs that tell the story about the pandemic here at the medical center going back to the beginning. So the first graph you're going to see starts January 1st, and this graph is the inpatient admissions. So the solid line is the moving average on a weekly basis of admissions. Mm-hmm. And you can see in the beginning of the year, we were averaging about 120 to 125 admissions a day,
yes,
which is what we typically have. Then you see a very dramatic drop-off in March and April. We nadir in the low 70s. And from there, as we've begun to open up, we've slowly come back. Yep. We're not quite to baseline,
no, but
we have come back kind of in a check mark sort of pattern. The second slide is actually our census, our 6 a.m. census, something we look at every day. And it's a similar kind of pattern. So back in the first part of the year, we were typically running in the high 600s, 680, that range. We dropped off again dramatically in March, and we nadired at
405.
405, Dennis, was our lowest census. And now we have slowly started to come back up, and we're still about 10 or 15% below where we had been. The last slide is our OR volume, and it shows probably the most dramatic effect. And this is really related to what the governor asked us all to do, which was to cut off elective surgeries. So the top line, the green line, are surgical hours, and the blue line down below are surgical cases. And you can see our surgical hours dropped more than 50%.
Yes.
Just a steep drop off because basically we turned it off.
We turned it off.
Yep. And again, in a check mark kind of fashion, we're starting to recover. We're not back to where we were in the beginning of the year. It's been a slow recovery, but we are making some progress.
And on that third one, there's a couple people down in the OR that you probably want to recognize who are helping us get back to normalcy.
So Dennis, there are a lot of people down in the OR helping to get back to normal. So Sharon Bessel and Rich Ewell, Dr. Ewell, are really leading the charge, but Stephanie Jones, the head of anesthesia, is playing a critical role. The clinical leads in nursing.
All the nurses down there.
All the nurses, all the anesthesiologists, the CRNAs, they're all doing a tremendous job.
All right. I think those graphs are interesting to look at, and of course we love looking at graphs, so we're going to keep sharing graphs like that to describe visually what we're seeing each day.
Exactly. It really tells the story of what happened to our volumes.
All right. Let's talk a little bit more about COVID before we change the topic. Convalescent plasma. Dr. Fauci today appeared in front of Congress with a couple other national health leaders. And Fred, he was giving an interim report on the status of the use of convalescent plasma. And he was talking about the protocol that the Mayo Clinic had developed, which is the same one we did here. And our principal investigator was Mark Judson.
Mark Judson was the principal investigator. That's right, Dennis. And we actually administered plasma to 85 patients. 85
patients. And what Dr. Fauci was telling Congress about convalescent plasma is when they look at the results across the country, it is, number one, extremely safe, and number two, that the outcomes appear to be very promising. So I think there's going to be some data published soon, but our own internal look at the use of convalescent plasma shows the same things, but when they look at it nationally, it's very promising, which is great.
Very much so. Very much so.
And obviously, we were the beneficiary of people in the community donating their plasma to make this happen. So thank you to everybody who did that.
Shout out to all of them. Thank you.
Yes, for sure. Speaking of looking at convalescent plasma, we have a quality department here. It's top-notch. Dr. McNulty, Dr. Keenan lead that group. And Fred, they've done an analysis on the transfers of patients from New York City to this area. And you have looked at this from a historical perspective, and I think you have a very unique look at things.
So Dennis, I described to you a book I read recently. It's called The Plague.
The Plague.
It's written by a Nobel laureate, a guy named Albert Camus. And basically he describes an outbreak of Yersinia, which is the plague, in Oran, in Algeria. And so they do something very classical in dealing with the plague. They close the city.
Close it off.
Close it off. And no one can come in, no one can go out. They're quarantined, they're isolated. They obviously bring supplies in, food and whatnot, but they keep all the sick people in that city.
Right.
And the book's actually an interesting book if you want to read it. It's about the effects of isolation on people. But that's traditionally, in a public health world, how you deal with outbreaks.
Right.
We did something different here. The hot zone, or the place where the outbreak
New York City.
Exactly, Queens was where the outbreak was really rampant. We actually, instead of bringing resources to them and keeping them there, we brought them here.
Because they were out of room.
They had no room. They ran out of oxygen at
Right.
one point, remember? We talked about that. And so we brought them here and we cared for them here. And two things happened as a result. One, they actually did better than their peers in New York City.
Right.
Number two, we did not infect people here. We did not have nosocomial infections related to that. We didn't have a surge of infections in our community related to that. We were able to care for them, get them well without spreading the virus.
Which is really incredible outcome on both areas, and we think an interesting case study for public health to look at. We're very proud of our efforts. We're proud of the region's efforts in that. And now that we have the chance to go back and look at it from a data-driven way, the results are really very encouraging.
You know, credit to you, Dennis, for having the ethical and moral fortitude to do that, to make that decision.
Oh, thank you, both of us. Together, we did that for sure. So thank you, Fred. Mentors. Yesterday at our Combined Center leadership meeting, I took the opportunity to talk about mentoring, and I talk about how when I was a medical student here, I was the beneficiary of a couple people who were really important mentors to my career trajectory. And interesting, Fred, we talked about how all three of them are still here.
Yes.
Dr. Snyder, Dr. McCurlin, and Dr. Bartfield. So it's a great opportunity for us to talk about the people who were recognized at the medical college graduation this year, who were recognized, as we do every year, as great mentors. So why don't you go first? There's 4 different categories.
4 different categories. So I'm going to read this. So the first category is the New Teacher Award. And that went to Dr. Danielle Wales from Internal Medicine. Yes. The second category was Outstanding Mentors, and there are actually 2 in that category. Dr. Jody Della Rocca in the CRNA school, and Dr. Michael Robeck, PhD in immunology and microbial disease.
Outstanding. So congratulations to all 3 of them. And then there was 2 more awards. So one is the Educational Development and Innovation Award, and that was given to an ER physician, emergency medicine physician, Dr. Richard Triweiler, who I work with in the ED. Dr. Triweiler is a great physician, so congratulations to him. And then the Faculty Teaching Scholar Award to an alum of our college, Dr. David Jones from the Department of Pathology and Laboratory Medicine, who I think has won the Golden Apple like 10 times.
I think every year
it's
David
unbelievable.
Wins it. Yeah.
So we're so fortunate to have these great mentors for our students and residents.
It's absolutely terrific. And speaking of students and residents, the new residents that'll be starting next week are here on campus going through their orientation. The rising 4th years are back, so those are medical students that are entering their final year, and actually the 3rd year students will be coming back shortly as well. So all of our educational programs getting back to normal.
We talk about how the academic year has a certain rhythm to it and how times of the year are a rebirth. The new people coming on campus is a
Yeah.
great thing. It feels like the start of a year, and we're doing it safely. The way they're coming on campus is being done in a way that's likely not to introduce any additional COVID
That's
onto
right.
the campus.
That's right.
So that's great. And I think Matt Markham was mentioning earlier how it just feels like the hospital is getting back to its normal activities.
We definitely are,
Which
Dennis.
is great. All
Yes.
right. So that's it. Tuesday, Thursday. So we'll be back again in 2 days with some more good news. And we'll leave it there. Once again, happy birthday to Kate. And to the rest of you, we ask that you please take care of yourself, take care of each other, and we'll see you Thursday.